Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. Internationally, those jurisdictions like Australia, New Zealand, and South Korea that have been successful at controlling COVID-19 have had testing as one of their fundamental pillars. In fact, the mantra in some of these places has been test, trace, and isolate. We in York Region are also using voluntary test shoppers to look at the customer experience and see what barriers exist so that we can remove those. So we are urging anyone with mild COVID-19-like symptoms to go for testing at the 3 hospital-based assessment centers, and they're open during the weekends as well. In addition, we are urging folks that may be contacts of cases, as well as workers who may have been in situations where the workplaces have got outbreaks, to definitely access testing. With respect to our homes, 4/5 of our homes that were in outbreak mode have now had their outbreaks resolved. However, there are still some that are very challenging to have the outbreaks resolved. In addition, we have recently seen 2 more homes that used to be in outbreak mode reappear with outbreaks. We are urging all staff at long-term care homes to get retested every 2 weeks. In addition to that, we are reviewing infection prevention and control practices everywhere in order to reinforce these. We are also seeing the introduction of travel-related cases now in York Region. Our workplace outbreaks continue to rise. Workers tend to get it from the community, and then one given worker may pass it to the next, and then to the next. These workers then tend to take it into their families, and so you get household contacts. Some of the workers work in multiple locations, and if they happen to be infectious, they take it to those other locations. Sometimes workers tend to carpool. Sometimes workers from different workplaces carpool in the same car. And so if one of them is infectious, you get spread to the other workplaces. What we do in public health is to go into these places, observe, and give recommendations. Our recommendations may involve health screening, ensuring that the employees are wearing masks, disinfection policies, staggering the lunch times, making sure that they have good sick time practices so that people can be off for 14 days, amongst others. Of course, the most important being physical distancing. We also map out the cases as an epidemic curve and keep monitoring things. And our inspectors with infection prevention control expertise go back into these homes. We also inform the Ministry of Labor and share our findings with them. We have put together a toolkit for businesses at our website, york.ca/COVID-19. This has many public health resources, as well as other useful information for businesses. In addition, we've been holding a number of webinars in partnership with Chambers of Commerce, our economic development area, as well as municipalities. Finally, I remind you again to physically distance, to wash your hands frequently, to wear a mask if you cannot physically distance, and to follow all the guidelines that we have been giving with respect to good hygiene. So continue to stay vigilant and remain safe. Thank you.